disorder, adultery hallucinations, lack of motivations, visual hallucinations, aggressive, laugh without reason, and etc. Symptoms of schizophrenia. We can see three major categories of symptoms here: positive symptoms, negative symptoms, and disorganized symptoms. In positive symptoms, hallucinations such as hearing voices or seeing things that do not exist, paranoia, and exaggerated or distorted perceptions, beliefs, and behaviors. In negative symptoms, we can see a loss or decrease in the ability to initiate plans, speak, express emotion, or find pleasure. In disorganized symptoms, confused and disordered thinking and speech, trouble with logical thinking, and sometimes bizarre behavior or abnormal movements. Positive symptoms, cognitive symptoms, negative symptoms, altered neurodevelopment, neurodegenerations. Cognition is another area of function that is affected in schizophrenia, leading to problems with attention, concentration, and memory, and to declining educational performance. Symptoms of schizophrenia usually first appear in early adulthood and must persist for at least 6 months for a diagnosis to be made. Here we can see different schizophrenia symptoms that are positives, negatives, and cognitives. In negative symptoms, we can see abolition, anhedonia, social withdrawal, difficulty paying attention, apathy, affective flattering, alogla. Schizophreniform disorder. In schizophreniform disorder, we can see delusions, hallucinations, disorganized speech, grossly disorganized behavior or catatonic behavior, negative symptoms, etc. In schizoaffective disorder, people with schizoaffective disorder experience symptoms a major mood episode of depression or bipolar disorder at the same time as symptoms of schizophrenia, grossly disorganized behaviors, or negative symptoms. Symptoms of a major mood episode must be present for the majority of the duration of the active illness, and there must be a period of at least 2 weeks when delusions or hallucinations are present in the absence of a mood episode. Schizoaffective disorder is about one-third as common as schizophrenia, affecting about 0.3% of people at some time in their lives. Magnitude and impact. Schizophrenia affects approximately 24 million people, or 1 in 300 people worldwide. This rate is 1 in 222 people among adults. It is not as common as many other mental disorders. Schizophrenia is frequently associated with the significant distress and impatience in personal, family, social, educational, occupational, and other important areas of life. During humanitarian and public health emergencies, extreme stress and fear, breakdown of social supports, isolation and disruptions of healthcare services, and supply of medication can occur. These changes can have an impact on the lives of the people with schizophrenia. During emergencies, people with schizophrenia are more vulnerable than others to various human rights violations, including neglect, abandonment, homelessness, abuse, and exclusions. Risk factors.
Please be aware of the time, okay? The time limit.
Okay, Laushi. In risk factor, we can lead exposure, neurochemical irregularities, parental exposure to hunger, dense living environment, etc. Treatment of schizophrenia. Evidence-based treatment for schizophrenia, medication, social skills training, family-based services, supported employment, cognitive behavioral therapy, assertive community treatment (SCT), illness self-management, treatment for alcohol and substance use, treatment for weight management, etc. SCMHT can be made up and provide access to social workers, community mental health nurses who have specialist training in mental health conditions, occupational therapists, pharmacists, counselors, and psychotherapists. Psychologists and psychiatrists. The psychiatrist is usually the senior clinical in the team. Care program approach CPA, acute episodes, crisis resolution team CRT, voluntary and compulsory detentions in the interest of the person one health and safety to protect others. That is the voluntary and compulsory detentions. Antipsychotics. There are two main types of antipsychotics: typical antipsychotics, atypical antipsychotics. The effects of antipsychotics include shaking, trembling, muscle twitches, muscle spasms. Antipsychotics includes drowsiness, weight gain, particularly with some atypical antipsychotics, blurred vision, constipation, lack of sex drive, dry mouth. Psychological treatment. There are two kinds of psychological treatment. There are family therapy and arts therapy. And CBT, that is cognitive behavioral therapy. In family therapy, discussing information about schizophrenia, exploring ways of supporting somebody with schizophrenia, deciding how to solve practical problems that can be caused by symptoms of schizophrenia. And arts therapy. Arts therapies are designed to promote creative expression of the patients. Schizophrenia, a review, that is a literature review. Schizophrenia is a devastating mental illness that impairs mental and social functioning and often leads to the development of comorbid disease. These changes disturb the lives of patients as well as their families and friends. Etiology and pathophysiology.
Sorry for the interruption. If already existed a time limit, you can just show us the slide and read the key points. Okay.
It's etiology and pathophysiology. Okay. This is diagnosis. And prognosis. Understanding the potential courses of disease can help guide treatment. Patients with schizophrenia have a high rate of substance abuse, and those with substance abuse have their first hospitalization at earlier age. Have more frequent delusions is directly proportional to their likelihood of rehospitalization. This is references. Thank you everyone for your patience. Thank you, Laushi.
Thank you. Thank you. There are a lot of
Actually, the time is very short.
Okay, it's okay. It's all right. There are a lot of information in the PowerPoint, and you've done a great job. But the problem is the same old problem. There are too many information in one slide, and there's a difference between presentation and reading. Right? You're gonna present your research, but not just to read all the the resources, the literature that you've have found. Okay. And the next group, please be aware of the time limit. Okay, so the next group, please.
Hello.
Hi.
Lucy, can you see my skin?
Yeah, I can see that. And Harley Quinn, right? I love that couple too.
Okay. So, my honorable Lucy and all of my basement, welcome to this evening. Today we are presenting about our research topics. My team and our research topics is anxiety and the panic attack. And we are presenting all of the mechanical engineering members, and our team name is Bengal Tiger. So there are the objective of the panic attack and the anxiety. So today we will discuss about the difference between the stress, anxiety, and the panic attack. Overview the common symptom of these attacks and the causes and strategies, listening activities, and the tip for the managing stress. How to will recover that. The combination of the stress and the anxiety and the panic is the stress. We can call this the perceived and the one's mind, body, speed, and the emotions. And the anxiety and the panic attacks have the shared symptom here. Like the anxiety is generally caused by the excessive worry and about the stressors, and the panic attack is the intense of often when it's come to nowhere with an obvious trigger. The simple symptoms of the anxiety is that the anxiety can causes many different symptoms. It can be how you feel physically, and sometimes you can feel it mentally, and sometimes we can see by your behavior. It's not always there easy to recognize when the anxiety is the reason to feeling of the acting differently. And the other things is the symptom of the panic attack is the racing the heartbeat, the feeling dizzy and lightheaded, feeling that you are losing control, and you are out of your mind. And sometimes it will be the sweating, trembling, and shaking. And the shortness of the breaths is breathing very quickly, and sometimes you can got the senseless or like that. And the tingling of your fingers and lips, and the maximum time of the day you are feeling sick and you cannot to attempt to do any kind of works or the other things. These two disorder, they have some both symptoms is similar, like the racing heartbeat and the chest discomfort, then the trembling, nurses, dizzying, muscles tension, and hot and cold flashes, sweating, and some the other things is number of the tingling sensations and shallow, rapid breathing, shortness of breath, like that. The causes of the anxiety and the sorry, Lucy, I missed some slides. And the other things we can see on the slide with the picture like that, the excessive and the anxiety and worry, and sometimes you feel restless, muscles pain, and you cannot sleep properly, everything it can be happen. The identifying of this case, if you know what's the causing anxiety, fear, or panic, it might be easier to find way some manage it. Some example and possibility causes include like sometimes when you are going to the work, feeling the pressure at the work and unemployment, and sometimes you might be the retirement. And the family, when you talking or gossiping with your friends or family members, they have some relationship difficulties, divorce, and caring for someone. It can be many quarrels with your family, with your life partner, like that. The financial problem, the unexpected bills or borrowing money from the other person, and the health issue is the illness, injury, losing someone, and different past of experience, bullying, abuse, and neglect. Every significant life event, such as buying a house, having a baby, planning wedding, could be the feelings, stress, and the anxiety. The common fears of these two syndromes is the dying, going insane, having heart attack, and fainting, losing their breath, losing control, embarrassing themselves, and choking. So, the fight to flight, the body resolves high levels of the adrenaline and the hormones such as the cortisol, and sometimes useful when the comfortable real physical threat, and but not the appreciate for non-physically threats. So now we're talking about how to survive of panic attack. Recognize that when you the anxious and give yourself the permission to feel it, fault with it, don't fight it. Breathe 2 or 4 breathing in time and use the positive self-talk and get busy, distract yourself, burn off the nervous energy, try to find out what is really bothering of you. And Lavshi, after this, one of our team member will discuss about the latest slide around 14. Hello, Jack. Can you hear me? Hello, hello.
Yes, we can hear you.
No. I am asking my teammate. Hello, Jack. Hello, Jack. Can you hear me? Hello, Jack. You will want to continue or I'm going on?
Please just going on. You have just like 2 or 3 minutes left.
Oh, okay.
Please be quick, okay?
Okay. So, of these causes, we have some medical conditions like some asthma, some diabetes, and some the legal or illegal drug issue or problems with the inner eye. Sometimes we can face the eye problem. And some the causes of my tendencies is the become the perfectionist and low self-esteem and observing thinking, need to appear in control, like that. And some the positive and negative self-talk, like negative thoughts are things that make us feel down, bad, and angry, sometimes scared. But when you thinking at the positive thoughts, you are comforting, the uplifting, and recognize all of the causes and not grows closer. So controlling and controllable, we can see here there have some things like our attitude, our behaviors, and some action. So about all of these research, what I'm thinking, actually not I am, our team is thinking Mars, what we worry about never comes true. We are might be happens, our fears and the situation much worse than our situation itself. Try to thinking as positive with a positive outcome, say what it can be happened, we can do, or always thinking positive. And there have some food or some physical or mental routine we can always removing our stress and our panic attack or some other disorder. So we are the end of the PPT because of the time issue. We want to say all of our teammates and our Lausi to say goodbye, and the leading line is the change the way you feel by changing the way you think. So thank you very much.
Thank you. Great. I like the way that you structure your PowerPoint, and you've covered a lot of key points of the topic you've researched. That's a great presentation. So next group, please.
Hello, everyone. Doctor, can you hear me? Oh, okay. Hello, everyone. I'm Lava, lead of the Priceless Brains Group. Our group is made up of 5 elements. Lava Jean Garcia, me, and Opinati Kelanos Valerian, Osain Mohammed Shakawat, Zayman Alitian, and Rabigui Innocent. So the main content of our topic, and right now, I will have a pleasure to give a brief introduction of the topic of our research. Use and development of the term. Various terms have been used to describe irregular emotional disorders. Many of the terms, such as mental illness, were used as psychopathology to describe adults with such conditions. Mental illness was a label for most people with any type of disorder, and it was common for people with emotional and behavioral disorders to be labeled with a mental illness. However, these terms were avoided when describing children, as it seemed too stigmatizing. In the late 1900s, the term behaviorally disorder appeared. Some professionals in the field of special education accepted the term, while others felt it ignored emotional issues. In order to make a more uniform terminology, the National Mental Health and Special Education Coalition, which consists of over 30 professional and advocacy groups, coined the term emotional disorder in 1988. So what is emotional disorder? Emotional disorders are a set of chronic and often recurrent psychiatric disorders that are associated with significant impairments in quality of life, productivity, and interpersonal function. Sometimes these disorders are increasingly conceptualized as neurodevelopmental disorders, as they frequently begin to emerge in childhood or adolescence and exert deleterious effects across their lifespan. When emotional disorders such as anxiety and depression coexist with physical illness, quality of life suffers, and outcome for treatment worsen. Therefore, the routine management of neurological condition should include assessment for and treatment of these disorders. The term emotional disorder encompasses a relatively heterogeneous group ranging from mild and transient to several depressive episodes. So, Lashi, now I will give the floor to the next group member of my group.
Hello. Just continue. Hello, Laushi. My name is Opina Ikela Mansli Valerian. So I will talk about the cause of emotional disorder. Emotional disorder can be caused by a variety of factors. For instance, genetic, environmental factors, family dynamic, date, stress, and pre-existing brain disorder. Laushi, so when you can see in this picture, you saw that this guy is crying because the emotional disorder can be caused also because of the dead. Sometimes he lost his dad or his wife. That's why this thing can be caused. It can be triggered following a bereavement, a disappointment in love, an accident. In most cases, the shock is caused by a negative event. So even when you are in love with someone, but you break up can also cause the emotional disorder, even when you make also accident. So the next one is often event that brutally confront date or the date trace as well a shock is sexual violence that are likely to cause emotional shock. Even you can see in that picture, sometimes someone make her to be sad. That's why she can have emotional disorder. Are we over to Sohan?
All right, so my rules in this presentation is to type of emotional disorder. I need to describe about that. So here you can say I summarize some emotional disorder in a list. It's gonna be like depression or a generalized anxiety disorder or panic disorder, and even have some other observed obsessive compulsive disorder or post-traumatic stress disorder. So if we discuss a little bit, depression is mainly a symptom of our feeling low and losing something that we are enjoyable. And we tried most of our time to change the appreciate and problem with sleep and concentration and memories. For generalized anxiety disorder, basically feelings easily tired and restless, having sense muscles, they may also trouble concentrating or sleeping. For panic disorder is kind of which may develop into provides such as a fear of being in place or situations that are difficult to escape from. And obsessive compulsive disorder basically is a strong feeling that the person must carry out or repeat a certain psychological mental process. And post-traumatic disorder mainly there are many also feelings that relevant to even through flashback, nightmares. There are also some physical reactions such as shrinking or sweating. And here I have some data I would like to show you. Over for 50 million people, they're suffering from neurological disorder. And here we can saw some data about 30 million people. They're affected by depression, 60 million affected by bipolar affective disorder. I got all of this information from a journal related to emotional disorder. And here you can see a chart about mental illness among adults. It's a data from the USA. And the common young old you can see data here. I don't need to describe anymore. So let's give the place to my next friend. All right.
I'm here to present the characteristic of emotional disorder.
From the ID definition, we found out that emotional disorder can affect physical, social, or cognitive skills of a person. That's why it's included in mental illness. We have some characteristic here, which is hyperactivity, which is abnormal activity, and aggression is when someone is aggressive. You can find like he can act anyhow when there is a small things happen. And then there's also withdrawal is when someone is out of society. And then there is immaturity is when someone can act like a kid. Let me say something can happen and then is inappropriately crying like that. And then there is also learning difficulty. That's kind of problem. It really affects academic performance because many times you don't focus. I'm gonna present too about the symptoms. Sign and symptom of mental illness can vary and depending on disorder, sequence, and other factors. Mental illness symptoms can is people with emotional disorder has different sign and symptom according to different factors. Also, mental illness symptom can affect the emotional health and behavior. As you can see here, there is some when she's feeling sad or down, confused thinking, or reduced is when she can't focus to anything. Also, there is excessive fears or worries when she worry about many things, but she couldn't get any of answers. Let me say if she gets some problems. So there is many things in this you can read and then you can understand more about. Let me just pass the speech to my friend.
To conclude this, we're gonna just conclude this. As we saw in our PPT, we discussed a lot of things, and this shows that this mental disorder or emotional disorder is something very big and some people really underestimate it. So I strongly advise anyone who feels depressed or really have some mental issues to get to the doctor as soon as possible, because every time this is a disease which is developing so fast because people are afraid to go to psychiatric centers or to see a psychologic like a psychiatric doctor because they are afraid of the shame or something. But this is a very serious disease, and it can be a very very strong disease, even better than other diseases we know which attack the body physically. But when it comes to mental, you can't really do anything. So I really strongly suggest to see a doctor and continue to tell all the people around the world that mental health is serious and it can be cured, and it can be really, people who have it can have special treatment. Thanks.
Alshi?
Thank you.
So we
Thank
finished our presentation. We sincerely apologize for the mistakes made during the elaboration of our project. So we accept your criticisms so that we can improve our work in the future. Thank you.
Thank you. It's all right. I like the statistical part of your presentation, and the way you deliver this research results and statistics is also very clear. Okay, so the next group, please.
Yeah, Loshi. Thank you, Loshi.
Hello, Lashi, can you hear me?
Yes.
Hello, Lashi, hello, everyone. I'm present. I'm present or living legend. I have a member, four member. Islam MD Naushad, Alim Jazgor, SK MD Faisal, as me, the group leader, Islam MD Tahirul. Emotions can be described as two main types. As two types, as picture mode, a sustained, pervasive emotional attitude which colors the whole life, particular life, affect, a short-lived emotional response to an idea or an event that people observe. Classification of mood disorders: manic episode, depressive episode, bipolar mood affective disorder, recurrent depressive disorder, persistent mood disorder, other mood disorders. Mania: marked increase in activity with exercise, planning, marked increase in sociability, even with previously unknown people. Harassment often involved in high-risk activities such as reckless driving, distributing money to strangers. Usually dressed up in gaudy and flamboyant clothes. When a lifetime risk to operate from 1.0% tends to occur in episode lasting usually 3 from 4 months, followed by complete clinical recovery. Future episodes: manic, depressive, mixed. Depressed mood, sadness of mood and loss of interest, pleasure in almost all activities, pervasive sadness, present thought, day, sadness, whereas from day to trend often unresponsive to environmental stimuli, results in social or dual, decreased ability to function in occupational and increased involvement in previous cerebral activities, severe depression, complete anhedonia, inability to experience pleasure, depressive, lifetime risk of common depression, 8 from 12% in males, 20 from 26% in female, lifetime risk of major depression, depressive episode in about 8%. Here picture. Depressive ideation, cognition, sadness of mood usually associated with presume which can result in three common types of depressive ideas: hopelessness, no hope in future; helplessness, no help in possible now; worthlessness, feeling of inadequacy, rarity. Depression level and suicide. Suicide should always be taken seriously. Factoring increase the risk of suicide. Features of marked hopelessness: males age 40, unmarried, divorced, written, verbal communication of suicidal intention, plenarily stress of depression. Recovering of depression period of 3 months from recovery. Bipolar mood disorder. Bipolar mode disorder characterized by recurrent episode of mania and depression in the same patient at different times. Yeah, here is picture, expression. See you. Recurrent depressive disorder characterized by recurrent at least 2 depressed episodes in bipolar depression. The current episode in recurrent depressive disorder is specified as one of the following. There is mild, moderate, severe without psychotic symptoms, severe with psychotic symptoms in remissions. Persistent mood disorder. Expression has picture. Persistent mood disorder characterized by persistent mood symptoms which last for 2 years. 1 year is children, but not severe enough to be labeled as even hypomanic or mild depressive episode. Persistent mild depression. Persistent instability of mood between mild depression and mild elation. Schizophrenia. Thank you, Laushi. Laushi, we are described details in our Word file, which I sent you in the morning. Here in PPT, we just talk a summary of it. Thank you, Laushi. Thank you, everyone.
Okay, thank you. Now here's the problem about the order of the group presentation is that there are groups want to change the order and there are groups that wasn't in the list before. So now the sequence is very confusing now. So now all the groups, please pay attention. For now, I will just, okay, so next group Alpha Omega I have already. Are you in this list before Alpha Omega?
Yes, Laoshi, I'm next.
Oh, yeah, okay. So
Laushi, my phone have no charge, so please give me after this group presentation is over. Laushi,
please give
Bengal
me
Tiger.
your group name.
My group name is Bengal Tiger.
Okay, there is another group, like the.
Okay.
There's another group. Peace of Mind wanna do the presentation after this group too. You two group can discuss with each other and decide which one we'll go to next. Okay.
Okay, Lamshi, I'm messaging him.
Okay. So now, if your group wanna change the order, you can just a message in the group chat, so the other groups they can all see, and it's better for that in this communication. Okay.
Yes, Laoshi.
Okay.
Laushi,
so,
I'm ready now. Laushi, I'm ready now. Bengal
okay,
Tiger.
Alpha Omega, please begin.
Okay, hello and good afternoon. We are the Alpha Omega team, and I'm Salih from Mabruk Zeljin. We have Omar Al-Faid Mehmed, we have Mia Shetu, we have Muatetema bin Ohari, and then we have Hussein Ahmed. So our topic for the day, or for the research, is ADHD, which stands for Attention Deficit Hyperactive disorder. This disorder is quite confusing. So I'm going to give a brief background introduction of the basics of how it all comes about. It's a disorder that has to do with focus and attention of a person. It's very complicated because this problem isn't a disorder or disease that can be easily pointed out, since it's an extremism of some normal problems of people. When I say that, I mean the symptoms and problems that have to do with ADHD are things that happen to every normal person, like not being able to focus on a homework to do it, or not being able to arrange things well, but just that in someone that has ADHD, it's an extreme condition. So now that we have the basics of what ADHD is, we are going to go deep into what it is. How ADHD affects the brain. The frontal cortex of the brain is responsible for organization, cognition, flexibility, self-control, and other stuff. Now, the frontal cortex works together with the limbic system to regulate emotional problems and other stuff. So the relationship between the prefrontal cortex and the limbic system is to help in the secretion of fluids that trigger memory in the brain neurons. So when the brain neurons receive these fluids that trigger the memory, the action of taking back the fluid in order to trigger another memory, that process has a problem when the person has ADHD. So the person is not able to focus on one thing. What this means is that just like we are in class, everybody is in a room or in a class or in a classroom, sorry. But there are so many things around one can focus on. Every normal person is looking at different things at the same time. But for a normal person, we can push away all those distractions and focus only on our screens or on only one thing so we can understand and absorb information. But with someone with ADHD, it's difficult to do that because at any moment in time, the person zones out of what he or she is trying to focus on, and this is not intentional. This is not intentional because sometimes the person wants to focus on the thing, but the brain, how the brain is working is different. So it's quite an irresponsible behavior that doesn't happen because the person wants it, but because the brain is working to say it's not very comfortable focusing on that condition. There are some symptoms that when they are extreme, we see a person can have ADHD. Symptoms like forgetfulness. When it comes to forgetfulness, it's not about the person forgetting everything the person does, but a person with ADHD has problems remembering things that just happen in a short period of time. A professor from Harvard who studied ADHD critically said, when a person has ADHD, the person has the brain of a sprinter, but the brain cannot process things of a long time. So people with ADHD can do a work that is in a short span of time, quickly and finish it. But when the work is supposed to be a long work, which you need to do step by step within a long period of time, they can't because they find it difficult remembering things that happen in the next 5 minutes, sorry, in the previous 5 minutes ago or 10 minutes ago. So there's a linkage to forgetfulness of things that just happened shortly. But things that happened long time ago, someone with ADHD can still remember with brain trigger neurons. When it comes to the next symptom, we talk about carelessness. A person with ADHD is always restless because he's thinking of so many things. And you hear them say things like, oh, I can multitask, I can do two things at the same time. When, frankly, people with ADHD only pause one thing and focus on another, coming back to the old thing they were thinking about and continuing it because maybe they could catch a few glimpses of what they were doing. Risky behavior. People with ADHD are always thinking a lot. So they end up taking serious risks into behaviors that are risky, like trying to run a Windows installation on a computer while eating, which might be risky because the food can end up, or the water can end up getting into the system and destroying it. The next symptom is difficulty in sitting still. People with ADHD can't focus on a particular thing, which makes it difficult for them while they are working. So in order to force themselves not to think of something else, they end up shaking one part of their body or getting up, trying to walk and read, trying to read while trying to solve another problem somewhere else. So you realize always they are not sitting at the same place, or they're always restless. Trouble getting along. It's difficult for people with ADHD to get along with people easily because it's hard for them to focus on people, like a particular person. A person with ADHD can make friends with a lot of people, but it's hard for them to focus on just one person. Daydreaming. People with ADHD could zone out at any time because, for example, you are in class and the teacher is teaching, a bird comes flying. Someone with ADHD, his attention gets a glimpse of the bird and he just wants to see what the bird is doing, but he's still in class. So at the end of the day, he looks at the bird until the bird gets somewhere, then he comes back to class, and the main focus of focusing on what the teacher is saying, he can't get, which means he just zoned out of the whole system. So daydreaming is also a symptom of ADHD. Excessive
Sorry to
talk.
interrupt. Please be aware of the time.
Yes.
We've got a lot of slides after, right? Please be
No, I don't
quick.
have a lot. I'm trying to combine everything in this slide. Then
Oh,
maybe I
okay,
save it
okay,
until later.
nice.
Excessive talking. People with ADHD can't focus. So in order for them to feel useful or something, they mostly kind of want to always be talking. So they are not sitting alone, because sitting alone will cause them to think of so many things which they think is burdening their brain. So at the end of the day, they end up talking a lot, trying to touch things, trying to move around, trying to jump. Another thing is disorganization. The biggest problem when it comes to ADHD is behavioral. And such a behavior is when the person can't start a work, or when he starts a work that is in the long term, like the Harvard professor said, it's difficult for them to finish the work. So you realize he starts the work, he doesn't finish it, he goes for another, doesn't finish it, he goes for another and doesn't finish it. At the end of the day, his whole table is messed up. Everything is disorganized. So you realize this is also one of the symptoms that has to do with ADHD. So everything I said in the other PPT is more or less here when it comes to children. So at home, at school, in social life, how they behave and stuff. It's all in the PPT. But because of time, we will just skip this part. All right, we will jump straight to the types of ADHD based on, we already spoke about the fact that the person cannot focus, the person fidgets, the person talks a lot. So depending on which of the symptoms are high, we can group the ADHD conditions into three. We have the first is the predominantly inattentive. When it comes to this, the person is more of not being able to focus than fidgeting and stuff. So maybe the person is cool, it's a calm person, doesn't fidget, doesn't jump around, but just has problems focusing. This form of ADHD, we call it the predominantly inattentive ADHD. The next type of ADHD is the predominantly hyperactive impulsive ADHD. When it comes to this kind of ADHD, the person isn't more of the person who can't focus a lot, but then someone who fidgets just to get himself in a good condition to do something. Smaller children tend to run, jump, climb, or just jump around, just not to focus on one thing because they find it hard focusing. Then there's restlessness. With the restlessness, it comes as a result of the person not being able to get him or herself together to do one thing at the same time. So when the person has so much restlessness as well, we say it's hyperactive impulse. Then we have interrupt others a lot and grabbing things from people. They tend to interrupt people, grabbing things, grabbing the person, pushing him, trying to joke all around, just so they don't sit alone and think of a lot of things. Then we have the combined ADHD. This is a condition that combines both the hyperactive and the inattentive ADHD. So we'll jump straight to the causes. The causes could be environmental, CNC, genetics, neuroanatomical, or neurochemical. But science has proven that the environmental factors aren't mainly the reason. Mostly it's through inheritance or neuroanatomical or neurochemical, since it can happen through birth when the parent is drinking or smoking too much and the brain is not able to form very well. Another thing is when the child falls on the head, when playing, when it's a baby, or in a very serious car accident that affects the brain. So let's talk about solutions and end at that juncture. When it comes to diagnostics, we say there are three forms of diagnosing ADHD. We have pharmaceutical, we have behavioral therapy, and we have parents and teachers. I believe the parents and teachers is still under behavioral therapy, so I'm going to combine that too as well. When it comes to the pharmacological, it's when drugs are given to the person to stabilize the brain and also help make the interaction between the cortex, the various cortexes in the brain work together so the person can focus well. This is not a cure. This is just a treatment to get the brain stabilized, and it's not one of the most advertised or advised because the person can tend to become addicted to that kind of drug. The next and the most recommended is the behavioral therapy and teacher-student or teacher-parents or parent-son interaction. The parents and the teachers or leaders in the society should help kids get organized, since with time they get to see that as a behavior and a habit, and it can reduce their ADHD conditions. So some say ADHD is laziness, but ADHD is not laziness. It could lead to laziness, but it's not laziness because people are smart and they can still have ADHD. People are hardworking and still can have ADHD. People are lazy and still can have ADHD. But the fact that the person can be stressed that he can't focus on one thing can lead him to be lazy, not to do that thing he has to do. So ADHD could lead to laziness, but ADHD is not laziness. And thank you very much. That is all I have for this presentation. And these are the references. There's a lot to say, but because of time and others waiting, thank you. It will stop here. And that's all we have.
Okay, nice. You've done a great job. So now we still have a lot of groups to present and we have little time. Please be aware of the time limit. Next group, please.
Hello, Laushi. Hello, Laushi.
Yes.
Can you see my screen?
No, I can't see your slide.
Oh, okay. Now, Laushi?
Yes.
Okay, Laushi. My group name is Bangla Tiger. We have 6 members in this group, Laushi. Ali Rafi, Jiko Sharif Hussain, Mubin MD Roviol, Karim Saidul, Sharkar Alamin, and me, Bablu MD Mir Hossain. I'm going to discuss about bullying. Let's start. What is bullying? Bullying is characterized by aggressive behavior that involves unwanted negative action, is repeated over time, and an imbalance of power or strength between the uh, perpetrator or perpetrators and the victim. Different types of bullying include physical, psychological, sexual, and cyberbullying. Physical bullying includes repeated aggression such as being hit, hurt, kicked, pushed, shoved around or locked indoors, having things stolen, having personal belongings taken away or destroyed, or being forced to do things. It is different from other forms of physical violence such as physical fights and physical attacks. Psychological bullying includes verbal abuse, emotional abuse, and social exclusion, and refers to being called mean names, being teased in an unpleasant way, being left out of activities or on purpose, excluded or completely ignored, and being the subject of lies or nasty rumors. Sexual bullying refers to being made fun of with sexual jokes, comments, or gestures. Cyberbullying includes being bullied by messages, i.e. someone sending mean instant messages, postings, emails, text messages, and creating a website that makes fun of a student or by pictures. Someone taking and posting online and flirting or inappropriate pictures of a student without permission. It also refers to being treated in a harmful or nasty way by mobile phones, texts, calls, video clips, or online email, instant messaging, social networking, chat rooms, and online hurtful behavior, physical fights. According to the Global School-Based Student Health Survey, a physical fight occurs when two students of about same strength or power choose to fight each other, and therefore is a form of physical violence between peers. The health behavior in school-aged children does not refer specially to school-related violence or to violence between peers, as it can occur between a student and a total stranger. Bullying. Today, our research topic is bullying and physical violence in school. We are going to work on this topic because day by day it's turning into a serious matter. It's high time to bring up the subject. uh, what are what are signs that a child is being bullied, being excluded from social gatherings or parties, afraid to go to school, may complain of not to feeling well, seems bad, lonely or depressed, having a difficult time sleeping, mood shifts. uh, Body shaming. Body shaming is the act of deriding or mocking a person's physical appearance. The scope of body shaming is wide and can include, although is not limited to, fat shaming, shaming of thinness, height shaming, shaming of hairness or lack thereof, or hair color, body shape, one's masculinity or lack thereof, shaming of looks, facial features, and in broadcast scenes may even include shaming of tattoos and piercings or diseases that leave a physical mark such as psoriasis. Sometimes body shaming can extend to a perception that one does not sufficiently display masculinity or femininity. For example, men with wide hips or prominent breasts or lack of facial hair are sometimes shamed for appearing feminine. Similarly, women have been body shaming lack or femininity or for appearing to have a man blog, or for having broad shoulder traits that are typically associated with men. Suicide because of the suicide body shaming is the fourth leading cause of death in 15 to 19 years olds. Extension levels of body shaming can have negative emotional effects, including a reduction in self-esteem and other issues such as eating disorders, anxiety, body image disturbance, body uh, dysmorphic disorder, and depression. Also, body shaming can lead a serious depression, especially when people feel their body cannot meet social criteria. Um, what can parents do? First, have a conversation with your child. Try to remain calm as you talk with your child. If your child has been harmed or physically threatened, call the school. Assure your child that you will help him or her find a solution. Find out who was involved, what was said or done, when did it occur, where are any bystanders, how did your child respond, how long has it been going on, who the child has informed. report it.
Sorry,
Can be
please
assertive
be aware of the time.
Okay,
Please be quick, and just show us the slide. Okay.
Okay. Students can be assertive by expressing anger in words that are direct and respectful, looking the person in the eye when speaking of them, using a calm, every tone of voice, speaking at the regular volume, by not standing too closely to the person, using the bully's name when addressing him or her. Assertive communication. Assertive communication is the essential middle ground between an aggressive comeback that escalates a bully's hostilities and a passive response that reveals a victim's lack of power. These skills need to be practiced. Tell an adult if you are being bullied. What if my child witnesses another child being bullied? Bystanders take for rules. Assistants who join in the attacks or victims. Reinforcers who support the bully's behavior by encouraging him or her. Outstanders who are aware of the bullying but do nothing. Defenders who comfort the victim, intervene for the victim, or report the bully. Let your child know that they need to make a choice when they see someone getting bullied. Be a witness, not by a bystanders. Pay attention, get involved, never ever look away. What can students do? Um, What happens at school if a bullying incident occurs? Within 48 hours of the reported incident, administrators will notify parents of the victim as well as the students accused of the bullying incident. An investigation of the incident will be completed within 5 days, and the superintendent will be notified. Administrators will respond to help the students. Administrators will notify parents of results within 10 days of the investigation. If appropriate, a safe schools report will be filled with the hooks set police department and the south. Okay, Laushi, that's it for today. Thank you everyone for listening me.
Thank you. So let's be quick. So the next group, please. If you're ready, exist 8 minutes just to show us the slide, okay? So next groups.
Hello, Laushi. I'm Abdullah Numan, and I will present now. I will be leading Peace of Mind. My group name is Peace of Mind. Well, can you hear me?
Yes.
Okay. So our topic was time management. This is our group. We are 5 persons. I am Numan, and here is my 4 other group mates: Kostas, Joachim, Meron, and Fire. And they all supported me to do this file, and I'm grateful to them. Hope they are all listening now. So we will basically cover introduction to time management, some difficulties, procrastination, planning, and goal settings. So time management is using the time available to you in order, and don't waste it. And managing it will give us many advancements and success in our life. So we should get 4 points: analyzing our time, keeping focus, setting goals, and scheduling our time. We get many difficulties to do this. Here is some examples. To get rid of the difficulties, at first we have to think about it, we have to discuss it. What are our main difficulties? This is a good method that I found online, and this is called RAC method. I find it interesting. It's basically record, analyze, and change. I have added a 1-minute video to show this. I hope you will enjoy the video. Sorry, Laushi, if I show the video, maybe it will get a long time. I will share the file so all our friends can see it later. I will just continue the presentation. Is it okay?
Yeah, of course. Please continue.
Okay. Procrastination is a bad thing, and this wastes personally half of my time every day. So I know how bad it is. And after taking this class, I'm getting rid of this, and I will think that my friends will also get rid of this. Here is the way how to prevent it. Actually, procrastination is putting off a task that we should be doing. Here is an example. So sometimes the task is unpleasant or difficult or tedious or boring. So we just try to waste our time by doing whatever we like or just doing procrastination. So here I also added some videos to check out later. And because of our smartphones and digital devices, we are often just using this and we are procrastinating. So here is some strategies to prevent it. We should take action. Here is another technique I found online, that is salami technique. And 5 minutes work on related tasks, do the hardest bits first, set goals, making commitments, rewarding yourself to achievement, and change subjects regularly. So I am just taking a closer look to the 3 strategies: the salami technique, making commitments, and rewarding yourself. Salami techniques involve breaking down the task to its smallest parts and then working through each of them parts by parts until the task is completed. It is effective. So here is an example. If you are going to write a big essay, you should take the steps. Making commitments, making promises, it is useful. We are working best when we are given tight deadlines or projects and assignments, and we can achieve higher grades and experience less stress. If we are working on a large pieces, such as studying towards the living certificate, we can give yourself deadlines to have to do it quickly and have successful achievement by the specific dates. And rewarding yourself, it is also a very good technique. You can set a reward for you that you complete or finish a task successfully and you get a reward. That is a good way to manage your time effectively. And time management is all about planning. We should plan our time well. Year timetable, this is for a year. On the starting of every year, we should plan for the whole year. We should focus on our study or on our work or on our other activities, but we should think what we will do this year, what we will achieve this year on the starting of our year. Then after, when the year finishes, we can do it. But year planning is not always effective. We'll next set a weekly timetable. This is effective because this is in our hand. Every week we can see our benefits, we can see our achievements. So we should plan out our individual week. We can make our own timetable worksheet, and we'll separate all our works, our important and not important works accordingly. And after ending the week, we can see where we have wasted our times, and we can try to recover the waste times in our next week. So
please be aware of the time.
Yes, Laushi, I'm not telling everything. And when you have found your available study time, you can plan the weekly timetable. Here is an example. How can we should plan our weeks? And this is a very good technique to manage our times. Goal is important. Without a goal, we can't work effectively. So whatever we are doing, we should set our goal and target, and we should stick to that. SMART goal, this is actually an acronym. It should be like that: specific, measurable, actionable, relevant, and time bound. This is called SMART goals. Goal is anything, but SMART goals is time managing, and we should write to-do lists before doing any task, so we can just check the list after doing every actions. So we should create to-do lists using SMART goals, and we should be keeping that every day in our tasks. Thank you everyone for listening to me and seeing my presentation. I hope you should get some use of from our presentation, and if anyone can get help from this and stop wasting our time, save some time to do something greater, something good, that will be my achievement. Thanks to everyone, thanks to our teacher, and thanks to my fellow classmates.
Thank you. A very beautiful PowerPoint. So next group, please.
Good afternoon, everyone. Lashi, can you hear me?
Yes.
Yes. Our subject is mental health. Welcome to our presentation. Our group name is Revitalize Mind. We are 5 people. Here is our group member. Our topic is anger management. So our research objective is this: what is anger, anger issues, violent behavior, and IED. Who has anger issues, scores symptoms of anger, medical scientific report, why some people are more angry than other, some causes, why do people get angry, what's going on with those people, how we can control our rage, relaxation like using humor, problem solving, better communication, cognitive restructuring, counseling, some of therapy for recover rage. Then summary. We mainly research on those topics. So here, what is anger management? Everyone knows what is anger management. So I will not would like to describe this. So here, anger issues violent because of our time shortage. Should I, Lashi, should I read this or just showing? Yeah, everybody gets angry from time to time, but when degree of anger or regression is greatly out of proportion to the situation, it's an indicator that something wrong. Seriously, anger or violence may be a sign or intermediate exponential disorder, IED. The acronym IED is ironic because it is the same as on use for improvise, explore evidence in where with IED angry exploration generally lasts less than half an hour and can leave you feeling relief, exhausted, and some times embraced by your words and action. Having ADHD or personality disorder also increase. So there are some information. And who has anger? More than 2.7% people all over the world have serious anger. Here core symptoms of anger. There are some core symptoms like rage, irritability, physical fights, verbal trouble, slaving, pushing, or other bodily harm, relationship troubles, work problem, school problem, legal issue, financial trouble, substance abuse, mental health issue, self-harm, suicidal behavior. There are many others problem. We research on it and we have read many articles. So there are some medical scientific report. This is a anger brain scan. This is like look like it's damaged brain, but see the healthy brain scan, it's look like good. So we should keep this healthy scan brain. So why?
Okay, I'm going to continue with why some people have more, like why people are angry than others. You know, we are different people, and some folks or some people, they are hot-headed. They mean like they react so fast. It means they have anger nearby. So means that we are different people, like we react differently. So there is some causes why do people get angry. We have losing patience. Some people they don't have patience. They can't wait for anything. When something happens, they can't wait. They just get angry, and it can cause some problems. So there is injustice, unfair things can happen, and they maybe say something to you that is not fair, so you get angry because it's unjust. There is no justice in it. Also, family and personal problems. Yeah, family and personal problem. There is maybe wife, a relationship, no kids, anything in the family can cause anger. And there is overstress. Also, overstress can cause anger. When you have a lot of stress, maybe can also caused by the family or personal problems, or can cause you stress. Then overstress can cause you anger, or can make you being anger, and it's not a good thing. It's can damage your your brain, as my brother Kamal say. Also, financial issues. Financial issues, we know all that if you don't have money, you are not happy. If you didn't eat, you are not happy. So please work hard so that you not have these issues in your family or in your personal life. Yeah, and what's going on with these people? Like the people, there are some people, if you react, there are some people that they have this anger, and they are giving to their children. That's why the doctors, they even emphasize moms and some pregnant mother to be happy always, because if you are not happy, how about the kid that you have in your womb? So you have to take care of your child. So here they say family history plays a lot of research as people arrange this can cause us the lack of emotional intelligence. So in our families, we have to teach our kids and our children how to behave, and how to overcome to overcome the anger. How can you react when you are angry? How can you react? We have to teach our kids. And it's good to let it hang. Oh yeah, it's good to let it. It's good to keep the anger, or it's good to let it out. So how can you react after being angry? I think the way you can listen to music or do something that makes you happy. Go to do some exercise, or go to play with your friends or family, just to forget that moment. And that will help you to let it go, or letting loose, to let the anger go away. And that's we hope. Thank you so much.
Hello, I would like to present how can we control our risk. So there are some point like relaxation, using humor, problem solving, then better communication and cognitive restructuring. So relaxation, simple relaxation strategies such as a deep breathing and peaceful images may help quieten down furious. So we can follow some strategy for relaxation like walk away, count 1 to 10, take deep breath using claiming self-talking, and saying like this, I can handle this, chill, it's not as bad as it seems. Then humor might can help claim an angry person down. For starter, it may help you see things from a more objective standpoint. Problem solving, plan ahead of time and track your progress. Try your best, but don't be too hard on yourself if the solution does not arrive immediately. There have some circle like problem solving: identify, define, explore, action, look back. Better communication, I think we should focus on better communication so we can decrease our anger. So cognitive restructuring, basically this indicate that you will have to change your thinking, and anger individual are more likely to cause. So it's easy to overthinking when you are upset or irritated.
Yeah, why do you need counseling? Actually, for anger management, it's very important to take counseling. So if you believe your anger is out of control, affecting your relationship and other essential aspect of your life, you may benefit from therapy or equilibrium. So how it work, you can see. And type of anger management therapy, there have some type of anger management like cognitive behavior therapy, dialectical behavior therapy, family therapy, psychological therapy, dynamic. And lastly, I want to say, do remember, anger management require practice, but it gets easier. The reward is really great. It will help you develop better relationship, accomplish your objective, and live a happier, more fulfilled life. So please avoid this anger management. With a better brain comes better life. It's comes to Daniel G. Amin, MD. Thank you so much.
With a better brain comes a better life. Thank you so much.
Thank you.
Thank you. Well done. Like the way you structured your PowerPoint and the content, they're also very great. Thank you. Thank you for your presentation. But yeah, but the time is a little bit, right? A little bit long. So now we don't have enough time for the remaining groups. So the remaining groups.
Lavshi, who finished their presentation, can they leave?
Yes. And for the groups who haven't done the presentation, you can just upload a video recording your presentation to me, okay?
Okay,
is it all right? Because I have another schedule after the class, so I will give you a link in the group. So the remaining groups, you can record your presentation and send it to me. Is it okay?
Losh, it would be a little bit hard for me. If you can just give me 5 minutes, it would be
okay.
So shall I start?
So please start. And the groups have already finished your presentation. You can leave.
can you see my presentation? Hello? Sorry. I'm really sorry. All right. Hello. This is Team Extent, and our research topic is effect of breakup on adults and its relationship with grief and its life. So, we're gonna me, Saif, PS, and other students. So, we are related to breakup for starters. You need to have a relationship. So, a human relationship is one of the first connection with other people, and what is that to another man. That's what a relationship.
Sorry, the network isn't very working now, so I can hardly hear you.
Oh, yeah, I'm sorry. Also, okay, what is a love? So love is a set of emotions, behaviors, and characteristics which characterizes intimacy, passion, and commitment, and it involves closeness, protectiveness, attraction, affection, and trust. And as I would say, like if any one of these is like lacking, then we would come to a breakup. And what is intimacy? Intimacy is a relationship in a feeling of being close, emotionally connected, and supported. It means being able to share a whole range of thoughts, feelings, and experiences that they have as a human being. And then comes to the breakup part, arguments. So when you're having a relationship, it's normal to have arguments, but when you keep on having repeated arguments on the same topic, it may cause a breakup, which means you and your partner are getting separated, and that, my friend, will cause grief. So so our topic is breakup and its effect on adults. So we're going to talk about post-breakup anxiety and stress right now. So post-breakup stress can be serious, and it can affect a person's as serious as physically. A really close friend of mine, due to the stress she suffered after a breakup, she was diagnosed with lupus. And what is lupus? Lupus is a serious disease that affects like your healthy organ, like where your antibodies inside your body starts to affect your healthy organs and starts to decontaminate, like diabetes and other, like even it can cause cardiovascular diseases, which is very serious. So so that's like that's what grief does to you, like stress, anxiety, and grief. That's what it does when you have a breakup. And here I'm going to talk about breakup and its relationship with grief. So while most of the callers, like people like us, leave emotional messages about various types of loss, grief grips most of them as they struggle with how to say goodbye to a lost love. So yes, love breakup can actually be defined as a form of grief. So there are 5 stages of grief according to some researchers, which would be denial, anger, then bargaining, depression, and acceptance. Acceptance being the final stage. The other 4 stages do not just go in one circular motion. They can vary from one to another. So what is denial? Denial is when you don't accept that you have lost something. You just you inside your head you keep on saying, no, she's still gonna come back. She's not going. She isn't with some other man. You just keep on thinking like it's not happening. It didn't happen to you, but it actually did. But you do not accept it. You keep on denying it. So that's what denial is. It's the very first stage you go through when like immediately, like when the news hits you, when someone died or your pet died, your parents died. You do not accept it at the very first moment, because that's what human nature is. We don't want to accept the bad news. We don't want it. That's what denial is. Then comes anger. When you are out of denial, when you're just starting to like understand that what's going through, you start to get angry. Anger isn't actually like the emotion isn't anger. It's just you are trying to mask your denial, your grief, but with anger. You're just trying to go and like be angry at the person for like, why did they do that? How could they do it to me? And how could they die? That question comes to your head. Like my father died in 2016. So I went through this even when for death. So that's anger is not like an effect; it's more like a mask. Then comes bargaining. So then this is the phase where you keep on asking like, what if or if only, like these questions you keep on asking like, what if I did this, then she wouldn't have had left me, or if only I had done this, if I had taken her to McDonald's a few times more, then she couldn't have left me. So that's what the bargain phase is. Then we come to depression, and this is the most longest phase in the circle of grief. Sometimes people fall in it, and this is the riskiest phase because people even may commit suicide while they are being where they're depressed. So it's in the early stages of loss, and we keep on like thinking like we kind of accepted it, but we're still in denial, and we cannot just get our head out of the fact that someone has left us or someone is like staying happy without us. We cannot just accept it. So that's when we get depressed. And to any of my friends out there, if you are facing depression, just take help from professionals, because I was going through the depression like months ago as well. So and I'm happier now, and thanks to everyone, all of every one of my friends to lift me up, and also my teammates and everyone. So depression is serious. You need to take it seriously, and you need to work on it. So next comes acceptance. And this is when you find peace. When you finally accept the fact that, yes, I have lost something. The love that was there is no more. I need to move on. And that's what acceptance is. Acceptance is the most crucial phase in the 5 stages of grief, and especially when it's come to relationship. And I've done my research on a sample size of a very small sample size, like that includes 10 people, and all of them are saying that they wish, like some of them are saying that they wish they could reach the point of acceptance, and some are saying that when they reach acceptance, that's when they find peace. So acceptance is the very like fruit of this discussion over here. So then comes recovery. When you accept it, that's when you start to recover. Then you know that you're building yourself up. Then you know that, yes, I have to change myself. I have to get better, because I cannot just stay stuck in the one point of life and then keep on saying, oh, I wish, alas, I could have done better. But that's when recovery is. That's what your friends are for. That's what your family is for. They're gonna help you. They're gonna get you up. They're gonna lift you up. You start going out again. You start meeting people again. Maybe you'll fall in love again. That's what recovery is. You do meditation. You do workouts. You start to love yourself. Like it's part of self development. Like and self-love cuts, as I said, as I wrote here, self-love cuts deep when it comes to recovering from grief after a breakup, and positive transformation of a person's body gives them a boost in self-confidence. Like just go to the gym, all right, just go to the gym for a month, and you'll see yourself transforming. And when other people look at you and they're like, damn boy, you look good, and that's the moment you start like feeling better. That's the moment you start like your face lights up, because okay, now I don't need another person to be happy again. So this is what recovering is after grief of the entire breakup ordeal, and that's the moment you triumph. All right, you end up being a triumphant man or a woman, and you just say, yes, I did it, yes, I survived. Like the Formula One driver, like my idol, Formula One driver and the 8 times world champion Lewis Hamilton would say, still we rise. And there's always, remember, there's a light at the end of the tunnel, and we just need to focus for it. We need to go to it, and we need to seek help when we need. And then we'll get a new beginning, because maybe then we'll fall in love again, and we'll find someone who actually loves us. Thank you for listening, and we're very open for feedbacks and questions. You're welcome. Thank you.
A very nice presentation. Great.
Thank you.
We specifically talked about the 5 stages of dealing with the grief and how to deal with the breaking relationship in a very deep details. That's great. So, okay. So is there another group that haven't done the presentation?
One more group. I was suggesting.
Okay. If you can be sure that your presentation can be limited to like 8 minutes, you can present now, okay? So please.
Can you see my screen? Can you see my screen?
No.
What about now? Is it showing now?
Yes.
Okay. So our group is the mental support PS, and we are talking about depression and its treatment. Yeah, so depression is an emotional or psychological disorder which comes with feelings of sadness, which is usually just sadness. Yeah, it comes with some different causes. It can be biological, psychological, and it can also be as a result of social effects. Things that happen around us can make us depressed. Yeah, so these are the symptoms of depression. It doesn't always mean that when these things are happening to you, you are depressed, but there's a high likelihood that most of these things will be happening to you at the same time when you're depressed. So there'll be the feeling of apathy when you don't really care about anything, not being able to sleep well, not wanting to do anything. That's the motivation, just not motivated to do anything. You can be in bed the whole day, just sleeping, eating junk food, just being there, doing nothing. You can also feel worthless, not feeling like you're important to anyone, just there, just that. Can be crying, depending on what happened to you or what your depression, but you can be crying uncontrollably, can feel tired, just tired for no reason, just tired. You can also be having suicidal thoughts, like it's a major thing that comes with depression. So most people who fall into depression easily want to take their lives, and all the pain they are going through, easily get angry, and they easily feel guilty for doing some things they might not even be responsible for. Yeah, so what causes depression? It's not a condition that has a specific cause. It can happen for different reasons, and it can be triggered by different things. So and it also doesn't work like suddenly. Sometimes it comes gradually. Sometimes it just sits there and takes you when you're not expecting. So there are some factors that affect the depressive process, and some of them are listed here: family history, hormonal dysfunctions, imbalances, addictions, trauma, separation, being overweight, just unhealthy, being under stress, getting bullied, and illnesses too can cause depression. Yeah, so it's not like, I can't say it's not scientifically proven, but it hasn't been proven to this fundamental level that there are things you can find in your DNA, your genes that can say that, oh, okay, if your dad was depressed, then you'd be depressed too. It's a chance you might get it or you might not get it. Yeah, so that's biology, but there are slight chances that people get depressed when their parents or other family members. Some illnesses have like effects on your mental health. Just having you to just think about whether you're going to make it out of the illness or not, how it's going to affect you, how it's going to affect your daily life, can cause you to overthink it, and it's going to lead to depression at a point if you don't take care of it well. So we have hormonal imbalances, menstrual cycles, menopause, low blood sugar, sleep problems, and some of these things are also as a result of the illnesses effects on your brain. So sometimes being on low sugar will affect some parts of your brain, and it's not going to be a voluntary thing, but you might end up being depressed. So there's the medication, drugs, and alcohol. There are drugs, there are medicines that you might be prescribed to take when you go to the hospital that might lead you to some form of depression, not because you are taking the drugs for fun, but on your way to recovery, that might be a side effect of the drug you're taking. Then there's the substance abuse of like drugs and alcohol, which usually do lead people to being depressed. The recreational drugs and alcohol use also helping you to alleviate some symptoms of things you are dealing with. They might be harming you in the long run. And personality is also one factor of depression. So people who tend to not talk about what's going on with them, just like to bottle it, get to a point where they can't bottle it anymore, and they might end up exploding with their emotions and all of that, and they will spiral into a depressive episode. So there are additional causes of depression, life events, losing your job, being in a dysfunctional relationship, stress at work, isolation, going through a breakup or divorce, being diagnosed with an illness, being unemployed for a while, grieving a loved one. While negative events can cause depression, they don't necessarily always cause it. Sometimes it comes and sometimes it doesn't. And there also is the parts where chemicals in the brains can cause depression. And in this case, it's not the fault of whoever is going through it. It's just body thing, and you have to seek medical advice so that your effects can die down quicker. Because if you don't, then the problem will still be there, since it's not an effect of a social thing. So there are types of depression, like types of conditions that come with depression. We have the major depressive disorder. We have the bipolar depression. We have dysphagia, persistent depressive disorder, and we have the baby blues that they usually call postpartum depression. It's depression that comes after you give birth, usually during the first few weeks after you give birth. You sadness, anxiety, and all of that just flood the maddest emotions, but with medical care, it can be taken care of. There's premenstrual disorder and there's seasonal affective disorder too. Psychotic depression and substance medication induced depressive disorder. And then we have the treatment of depression. We have the transcranial magnetic stimulus and electroconvulsive therapy that is to treat depression in the brain. And these types of depressions are used in therapy and lifestyle changes and medication have not really helped. So these are a list of psychotherapy, medication, depressive disorders, experience, natural treatment, and alternative like electroshocks. And you can also guide yourself through depression. You have to make conscious effort to change your lifestyle, how you spend your day, how you spend your time, how you do some things to change your depressive state. Is you can also go to therapy, counseling, psychotherapy with a qualified a health provider. You can also go for alternative health, acupuncture, hypnosis, or biofeedback. Brain stimulation also, there's the ECT and TMS we've already talked about, and you can also try the vagus nerve stimulation. So thank you for listening. Thank you to my teammates there. So, yeah, done.
Okay, thank you all for your presentation and your hard work. So there's no remaining group, right? I suppose all of you have already finished your presentation. Okay.
Yes.
So this is the end of our today's class. Thank you all for your hard working during these 8 weeks, and hope you all have a bright future. Bye. Have a nice
Thank
day.
you, Laoshi. Bye.
Thank you all.
Bye bye,
Thank
Laoshi.
you,
Have a
Laoshi.
nice day.
Bye.